Hi, I'm Dr. Mansour, naturopathic doctor at Anatara Medicine. Today we have Dr. Shawn Tierny, ultrasound guru and extraordinaire, who will talk to us about some of the more innovative approaches to using ultrasound-guided hydrodissection.
Yeah, the nice thing about C1 is we have the opportunity to address parts of our nervous system that get affected if you have chronic infections or just overall dysregulation. So C1 plexus, we call it. So the C1 plexus sits in front of C1, and a lot of cranial nerves come down in front of C1 just because that's the area where nerves can come down and they take the least amount of torque, or they're not being stretched as much. So in front of C1, you have your occipital nerve, which is your C1 nerve root that controls the occipital muscles. So if your occipital muscles are not functioning, you may have some upper cervical instability.
Yeah.
So by hydrodissecting that C1, a lot of times it enhances the function of the suboccipital muscles, and you have significant changes in your upper cervical instability. So it becomes more stable. The other thing that is in that area is going to be your hypoglossal and your glossopharyngeal nerves, two nerves to the tongue, along with the vagus nerve that also goes to the tongue, among many other places. So the sensation of your tongue, your taste is going to be your hypoglossal, glossopharyngeal, and vagus, and they all sit between the C1 and the digastric, and more directly, there's a muscle in front of C1 called the rectus capitis anterior. So it's more sitting between the rectus capitis anterior and the digastric muscle in a very clear fascial plane, along with the occipital artery and the internal jugular vein. Before you get to C1, usually the superior laryngeal nerve splits off. So then you have a plexus in front of C1 that includes the superior laryngeal nerve, controls your voice and your swallowing, the tone of your voice, probably has a lot to do with your ability to sing, as well as swallow. So then you have your superior laryngeal nerve, your vagus nerve, your hypoglossal nerve. Your vagus nerve is going to control sensation to your tongue, but it's also going to control blood flow to your brain. It's going to control blood flow to your gut, your digestion. It's going to be related to your heart rate and your blood pressure. And the vagus nerve, along with the sympathetic chain, kind of functions to moderate your heart rate and blood pressure. So dysregulation in this area, I think you can automatically see, is going to cause some significant changes directly in your digestive system, because obviously these nerves are associated to your mouth and your tongue, but then they're also associated to your gut. So this is an important area to focus on when we think about gut health, but also when we think about heart health. And what we're seeing now, a little bit to our surprise, but pleasantly, is that a lot of these post-COVID cases. So post-COVID, we have to think of that as being a C1 plexus problem for a lot of people. So why would that happen? I think, any kind of infection can cause irritation to the C1 plexus if there's lymph nodes that are right next to it. For some reason, COVID maybe affects that area more. Obviously, we know we have a loss of taste a lot of times with COVID, a lot of times loss of smell, sometimes even some effects on hearing and vision. Because this vagus nerve, like I said, does control the blood flow to the brain, which can affect hearing and vision. But also in that plexus, around the digastric nerve is also going to be our facial nerve, and more particularly associated to hearing, the nerve to the stapedius muscle. The stapedius muscle controls the tone of the eardrum. It attaches to the stapes, and it's kind of the focusing ability of your hearing. Also, importantly, it also controls the position of your auditory canal. So it's controlling the pressure in your middle ear. So you can imagine if you have a loss of control of the tone of your eardrum, or a loss of control of pressure in your middle ear,
Dizziness.
that can cause some problems.
Proprioception, balance, things a lot related to COVID as well.
And then the biggest, scariest thing is, I think for a lot of people, is that all these electrical heart problems, blood pressure, and where, literally they feel like they're going to die, because their heart rate goes too high, goes too low, their blood pressure goes too high, blood pressure goes too low. And it can be just, a very irregular thing and disconcerting. And really one of the most common things we see with this is postural hypotension, where you stand up, you get a little bit dizzy, you don't have the endurance to do the most basic activities.
So POTS.
Yeah.
And then like the blanket term of dysautonomia, which can be related to C1 and craniocervical instability or CCI, and those things can also be
right there.
Yeah.
So whether it's instability or so that all these things are happening at C1. And there's a in chiropractic, there's a group of chiropractors, we used to call them HIO, where they focus just on adjusting C1 and propose these amazing results from that. But I think as we understand the anatomy there and understand the functional, we can see why, hey, maybe this does make a big change for a lot of people. Does it have to be perfectly aligned? I think we're probably better aligned if things are working better. But certainly getting that area as healthy as possible can make a big change. So let's go back to, other things that happen at around that digastric. Your spinal accessory nerves also begin wrapping around that digastric, right around that level of C1. And we do get a lot of this spinal accessory nerve issues where your trapezius and tightness across the shoulder can be associated to that as well. So I think that what we're starting to see, where we're starting to pick up is this is an important area. And it's especially important if somebody has had an infection or an immune reaction that immediately caused some heart irregularities, some digestive irregularities, some tasting irregularity, some hearing irregularities. And we can make a change, and a surprising change.
And even with like toxins, so like mold, Lyme, all increase those, lymph nodes swelling in that area. Those are
any kind of infection. And I think it's particularly those chronic infections. And then the secondary thing, which may be actually a chronic infection, we really don't know, is this COVID, where we have that irritation and adhesions, and inflammation in general tends to cause adhesions. And adhesions are a term that's floated around by a lot of professionals and non-professionals. It's like, hey, I have adhesions. What may not understand exactly what they are. My simplest way to explain it is, if you ever rip your skin open, you know that somehow it gets stitched closed back together. It kind of closes on its own. And how does that happen? Because your body tends to throw out webs. So I'd rather think of them as webs. Your body's throwing out webs. Platelets, when they aggregate, they throw out webs, and you start to stitch things back together. And then when you have something that's torn apart and then there's inflammation because of that, it makes a lot of sense. When we start to get these webs forming between muscles where nerves need to move, and they're restricting the nerve's ability to move and get circulation, then maybe those webs or those adhesions are now a different kind of problem. And one of the great tools that we have now using musculoskeletal ultrasound, or we should maybe call it neuromusculoskeletal ultrasound, we can look at a nerve in a fascial plane and put a needle into that fascial plane and inject fluid to actually separate the fascial plane. So it's an actual true myofascial release. So we're separating, creating space. A lot of people talk about doing myofascial release with physical therapy or chiropractic from outside of the body, which is a great thing to get things to function, but they're really not getting that separation that you can achieve with hydrodissection. And the old way to get a separation there, to dissipate those adhesions, was to use a scalpel. The only problem is now you had a cut, and now you're going to get the adhesions back for many, if not most people, in a few weeks. So yeah, we've seen some. Yeah,
and post-surgical adhesions. So even if you are using scalpel, it creates more scar tissue, more adhesion, more dysregulation with the nerves floating in and out of those fascial planes. So definitely for post-surgical, can be a really big game changer.
Gotta agree. And a lot of surgeries are successful according to the surgeon, but you still have persistent problems, and it's distressful for the patients. It's distressful for the surgeon. Everybody wants their patients to get better. Everybody wants patients to get better. And now we have this technology. We can go in there, a surgery that maybe had some residual pain, and because there was adhesions, we can actually go ahead and look at the nerves and those adhesions and separate the myofascial tissues and the connective tissue and actually get a result from an otherwise successful surgery, but for whatever reason led to excessive adhesions that irritated nerves and caused chronic pain.
So for C1, how fast do you see results from an injection in that area?
Yeah, that's one of the nice things and the rare things that different types of doctors will see in their office is an immediate change. So I'm drawn to a patient that I can think of that we saw recently after having COVID. Her heart rate and blood pressure was dropping. So she was not a young woman, but her heart rate was 30 beats a minute, which is like once every 2 seconds. And she was looking at getting a pacemaker. She was very fatigued. She would pass out. She had this postural hypertension. And she came in for another reason. I said, we might be able to help out because when we work on this vagus nerve at C1, a lot of times we see that problem change. So, we did an injection, and with 10 minutes, her heart rate was 72 beats a minute. And it has been 72 beats a minute for the past 4 months.
That's
so
it's a lasting change.
It can be this lasting. You can get this lasting change, and I think it's also if you almost immediately, and not all, but some cases, you can tell that there's a difference, and a lot of focus issues are either because the brain is too busy or the autonomic system is dysregulated. So one of the things we'll do is we'll do the opposite of doing a vagus nerve hydrodissection, in a sense, because a vagus nerve hydrodissection enhances the function of the vagus nerve. But another way to address a positive change is to block the sympathetic chain at the stellate ganglion lower down in the neck, where we actually use a local anesthetic, and that blocks the sympathetic chain. And you think, how does that help the nerve? Because what it does is it turns off the fight or flight side, which is the sympathetic chain, and allows the parasympathetic, the ped, feed, and breed side of our nervous system to function normally. Because normally there's this play between the fight or flight and the kind of the vagus relaxation, digest our food, function, relax, feel good. And when one side overrides the other, then we have issues. So in the case of this autonomic dysregulation, do we need to do a C1 hydrodissection or a stellate ganglion block? And I think a lot of times the right answer is both. I think if their blood pressure is low, you probably wouldn't want to do a stellate block that day. You'd want to maybe do C1, and then eventually when everything is functioning, we can do that. So
because you want to upregulate with the C1, and then the stellate is more to kind of relax, control, alt, delete, kind of.
Yeah. So to get into the stellate, I think that there's a lot of research on the stellate, and I think Dr. Shawn Mulvaney has done most of that research. And we're over 20 published studies. And one level 1 study, case controlled, double blind, large numbers, multiple clinics study that's shown, hey, this is effective for PTSD, but it's also effective for other autonomic dysregulations. And why did I just go from PTSD to autonomic dysregulation? That seems like a weird jump, right? And I think it is, I think it is. But I think what I have come to recognize. And I think there is not the literature behind this, but what we've observed is that if you do a block to the sympathetic chain And for somebody who has PTSD and you use a short-acting local anesthetic, they feel the same as if you used a long-acting anesthetic, except for they don't have any lasting results. So then, well, that's interesting. So then you have to start to think, well, maybe we need to actually turn the machine off for a certain period of time until you can recover, right? So I thought that was just what we had to do. And I'm like, what is it? Why? I think it, and I'm thinking, well, maybe it's a metabolic problem, because if we need to clear the excessive neurotransmitters out of the synapse, out of our nervous system, when we shut down that hyperfunction and take the nervous system down to a normal level, metabolically, we have more energy to clear the synapse. So I thought maybe that's the issue. And then I was working with another colleague of mine, and his name is Dr. Scott Waugh, and he was telling me he is getting really good results with doing these peripheral nerve blocks for people that have peripheral neuropathy and peripheral neuropathic pain. And so I said, what are you using? Well, I'm using some ropivacaine, some long-acting local anesthetic. And I said, well, why don't you use lidocaine? Well, it doesn't work as well. So then it's like, oh, well, maybe this is something similar. So maybe these peripheral neuropathies, and we even call them metabolic neuropathies, are that metabolic overload where that nervous system is running so fast, those nerves are pushing so hard, they can't metabolically recover, so their sensation of pain and their function of managing that part of the body gets thrown off. So when we do that, block and turn those nerves off, they come back with less pain and more function. So there's this thing where maybe what we need to do sometimes is allow the nervous system to recover.
And it needs that duration aspect. So instead of using lidocaine, use something longer acting like ropivacaine.
Right. Yeah.
That makes sense.
Yeah. So I call the Stellate block. It's 3 years of Zen meditation in 2 minutes. So, all of a sudden, I feel at peace. Well, that was hard to get there if you're too busy and too stressed.
Yeah. Well, thank you for your time.
Yeah.
And this is Dr. Mansour. We're here at Anatara Medicine discussing some of the more innovative ways we can use ultrasound guidance for re-regulating the nervous system. And thank you for your time, Dr. Tierney.